the symptoms were silent and subtle.
My stomach just didn't feel normal.
I had some pain in my pelvic region and some bloating.
And at the age of 18, you don't really think that anything's going to be wrong.
A lot of cramping in the lower abdomen.
I thought I knew a lot about the disease being in cancer research.
There is a way to break the silence.
Ovarian cancer is a cancer that arises from the ovary. It is the #1 killer in terms of gynecologic cancers of women. My name is Barbara Goff, and I am a gynecologic oncologist. I practice at the University of Washington and at the Seattle Cancer Care Alliance. And then also I do a lot of research. The primary focus of my research right now is in the early detection of ovarian cancer.
My name is Cheryl Sines. I'm a gynecologic oncologist at the Moores UCSD Cancer Center here in San Diego, California.
The reality is that you can get ovarian cancer in your 20s, you can get it in your 90s, and so it really does span the entire reproductive age range of a woman. About 85 to 90% of ovarian cancers occur in women who are considered average risk. And that's what, of course, is frustrating, is that average risk women have about a 1 in 70, 1 in 65 lifetime risk of ever developing ovarian cancer.
I'm Naomi Whitaker, and I am very proudly a 6-year survivor of ovarian cancer.
My name's Laura Shaver, and I'm a scientist by training. I was diagnosed exactly 2 years ago.
I was diagnosed when I was age 18. My name is Kim Sager, and I'm an ovarian cancer survivor for about 20 years.
I'm Georgiana Correa, and I have ovarian cancer. I have stage 3C.
For a small percentage of women, there is a genetic component that puts them at risk for ovarian cancer. And in those women, the risk can be as high as 65%. So if you look at sort of the symptoms that are most commonly associated with ovarian cancer, and those would be things like bloating, abdominal pain, pelvic pain, difficulty eating, feeling full quickly, urinary symptoms, particularly urinary urgency.
When I looked back at it and when I learned what the symptoms were, I would have said I probably had them for at least 6 months.
I attributed my symptoms to side effects from the hormone replacement.
Nobody really wants to be ill. I definitely never wanted to be ill. That denial can really be our own worst enemy.
I had a large tumor. It was grapefruit size. I probably had the symptoms that I was experiencing for a number of months looking back on it.
Unlike cervical cancer, which has the pap smear, or breast cancer, which has mammography, ovarian cancer has no screening test.
And that really is the main contributing factor to why we don't pick up the disease early and why we ultimately lose more patients. Women that are diagnosed with stage 1 disease, we cure about 90% of those women. But in women that are diagnosed with stage 3 and stage 4 disease, we only cure about 20%. And unfortunately, about 75% of women are diagnosed with those advanced stages.
I think one of the most important lessons that I've learned is how important it is to be your own advocate. Doctors are busy. You know, I was a healthy person. There's no reason to really look carefully at me. I wasn't a high-risk kind of person.
Always ask for a second opinion or a third opinion. And this is not something that people should be embarrassed about.
It surprises me how many patients actually don't get a second opinion when it comes to cancer. I think most physicians are not insulted by patients seeking a second opinion. I personally encourage my patients to seek a second opinion.
The entire scope of research that's being done by Dr. Goff and her colleagues at the University of Washington is new to medicine, it's new to GYN oncology, and it's new to general OBGYNs. Unfortunately, even when I went to medical school, we were not taught this. This is new, so that if providers are out there, they may not necessarily know that Dr. Goff's research is ongoing and has shown substantial differences in terms of the way that we look at symptoms in ovarian cancer. Unfortunately, we're talking about changing the culture surrounding ovarian cancer and surrounding what was taught in the past and the myth and the lore that's gone along that this is a silent killer. It's not silent. There actually are symptoms, even early in the disease.
When I was first treated, I went into remission for 9 months. I am in treatment again now.
I still continue to struggle with having recurrent tumors, and over my course of lifetime I probably will have a couple more operations, unless of course we find a cure, which is, we're all hoping for that.